I'm Bob Sherman. I'm a respiratory therapist, and I'm going to be addressing the signs and symptoms of emphysema. Emphysema is a component of chronic obstructive pulmonary disease, or COPD as it's known. It is usually caused by smoking. There is a condition called alpha-1 antitrypsin deficiency, which also leads to emphysemic changes in the lungs. And emphysema, what it is essentially, is a breakdown of the lung tissue in the small airways beyond the bronchial tubes in the air sacs where the gas exchange takes place. This can lead to a host of problems in the body, including some cardiac issues. The symptoms mainly are shortness of breath and difficulty exhaling. And one of the signs of emphysema that you'll see is what we call pursed lip breathing, where the person will kind of, on an exhale, to create a pressure in there to keep the airways opening. What happens is when a person tries to exhale, those airways close off and causes what we call air trapping. And that can lead to another condition called barrel-chestedness, which essentially is the lungs filling up the chest cavity. With emphysema, there's an increased effort to even be able to exhale. That can it leads to hyperventilation, which eventually, with fatigue, can lead to hypoventilation and eventually respiratory arrest. You also can get a condition called pulmonary hypertension, which is essentially high blood pressure on the right side of the heart pumping blood to the lungs, which can lead to some cardiac issues and make the heart too muscly and cause some cardiac issues down the road as well. Everybody experiences some emphysemic changes, just with age, but with smoking, that's accelerated. And people end up on oxygen, and eventually too many of them end up going into respiratory arrest. So without stopping smoking, it'll eventually be fatal. So that's how I see it as a respiratory therapist. I'd also recommend that you reach out to your doctor for more details, or you can go to Google and type in early symptoms of emphysema for more information.